This is Scott Becker with the Becker Private Equity and Business Podcast. Today's discussion is the top problem in healthcare. So we're going to discuss this problem. It's really a math problem, and it's ultimately a relatively simple math problem. The biggest problem I see in healthcare, and it cascades into other professions in healthcare as well. So it's not unique to physicians, but we've got a math problem in that the number of physicians we have, 1 million plus, compared to the population we have, is a number that just doesn't work. This is a particularly challenging problem to solve in specialties versus primary care. And I'll explain that in a while, even though that's not a popular thesis. But this number one problem that we have in healthcare is just simply a math problem. The number of hours available of physician time compared to the number of people we have in an aging population, 330 million, is a number that doesn't work. And the really sad thing about this is a problem that is in some ways quite solvable, because the medical education system, while turning out fantastic physicians, is completely developed pre-internet, and if not broken, it's become completely inefficient and completely expensive. So the typical time frame now to turn out a doctor is 4 years of college, 4 years of medical school, then 4 years of residency, and then finally often a fellowship on top of that. So you've put yourself in a situation, and this compares to some other countries, where we now have almost a 12-year process to produce doctors. So doctors aren't really doctors and practicing until their early 30s. And what's happened is we've fixed some problems, we've created other problems. We're in a situation where half of all doctors are done practicing full time almost by the age of 40 or so. So we've got this incredible math problem that is, I view it as somewhat of a self-inflicted wound. We solve some of it by immigrating in lots of doctors, and thank goodness we're able to do that, but that's become more challenging as well. We also know that in reality, that's a zero-sum game, because we're leaving other countries with less doctors, so it's really not a great solution. The second thing that we do, and is we have to find a way, and there's so many built-in forces against this, to shorten the period of residency and medical school and so forth. You have to remember, the medical school curriculum, the residency program, was developed literally prior to the internet. So when it was developed, there was this huge desire to memorize as much as you could, to keep everything memorized, do everything in that way. And what's become clear is now all that information is at one's fingertips, so there's not the need to memorize anything. So people are coming out of med school, $300,000 or $400,000 in debt, and they also often don't make enough money during the residencies to support themselves, so they're really adding to debt there too. And it's become an unsustainable, stupid situation, self-inflicted wound. And I got to believe, if right now, taking away undergraduate, it's taking 8 to 10 years to produce a doctor, I can't believe we can't do that in 5 years or 6 years or something like that and get doctors out a lot quicker. Right now, we're producing about 18,000 doctors a year, about 20,000 start medical school. About 90% of those end up with residencies at some point. So my guess is we're producing 16 to 20,000 doctors a year, and those numbers don't work. I've also heard from, and we all know in the specialist world, those numbers are just absolutely horrible. I was on the phone with somebody in Texas. They've got one neurology in an area of about 250, one neurologist, and there are about 250,000, 300,000 people in a situation where neurological problems are expanding. The same thing is true in behavioral health, all kinds of other areas. The specialist problem is much more acute than the primary care problem, because primary care can be handled by a lot of advanced practitioners at the top of their licenses. A lot of specialties cannot. In any event, a huge need to produce more specialists much more quickly as soon as we can. Thank you for listening to the Becker Private Equity and Business Podcast. We've got a horrible self-inflicted wound here, and we've got to fix it. If you listen to this all the way through, you're the first person to text me that listened to it on the Becker Private Equity channel. I'll send you a $100 gift certificate. The text number, 773-766-5322. You have to be the first listener to text me. Thank you very much for listening.